In this video, we'll take a quick look at how electrical signals are conducted through the myocardium. The cardiac conduction system coordinates the activity of the heart so that it acts as a whole. It also times contractions of the atria and ventricles so that they don't contract at exactly the same time. The atria have a chance to discharge all their blood into the ventricles before the ventricles contract. Our first stop is in the upper wall of the right atrium at the sinoatrial, or SA, node. This is the true pacemaker of the heart, a little cluster of spontaneously firing autorhythmic cells. The sinoatrial node has an intrinsic rate of about 100 beats per minute, but the parasympathetic nervous system and hormonal influences slow it down to about 70 to 75 beats per minute. So if you cut the vagus nerve innervation to the heart, your heart rate actually goes up, because then the SA node isn't getting that parasympathetic inputs. If the SA node fails to work correctly, a surgeon may install an artificial pacemaker to take the place of the SA node and tell the heart when to beat. Impulses from the SA node pass through the myocardium, triggering contraction of both the right and left atria. They also pass to our next stop, a cluster of pacemaker cells in the lower right atrium called the AV node. The AV node pauses electrical impulses. It's a short delay, just about 1/10 of a second, 0.1 seconds. But this gives a slight delay between the electrical activation of the atria and the activation of the ventricles. It's this electrical delay that allows the atria to finish contracting before the ventricles contract. The AV bundle is a pacemaker bundle, but its intrinsic rhythm is only about 50 action potentials per minute. So, if your SA node stops working, the AV node can stimulate ventricular contraction, but not at a rate that supports much physical activity. Depolarization at the AV node is conducted through the AV bundle. The AV bundle is also known as the bundle of His, HIS. This AV bundle is the only electrical connection between the atria and the ventricles. So if something goes wrong with the bundle of His, the ventricles are not going to be doing their job. From the AV bundle, depolarization is conducted through the bundle branches. The right and left bundle branches send impulses through the interventricular septum, that myocardial wall between the left and right ventricles. Heart patients can sometimes develop what's called a bundle branch block, where the electrical signal can't pass through the bundle branches. It's usually asymptomatic, but it can cause fainting or a low heart rate and may require a pacemaker. A number of things can cause this impairment: heart attack, congestive heart failure, hypertension, or just a birth defect. Purkinje fibers branch off from the branch bundles and carry the electrical impulse throughout the ventricular myocardium. They also lead into the papillary muscles, so that the papillary muscles get the stimulation to contract and the AV valves get pulled shut by the papillary muscles. When depolarization passes through the Purkinje fibers, contractile cells of the ventricles are depolarized in turn and contract. In this video, I've walked you through the cardiac conduction system step by step. This slide puts it all together. You'll have your SA node up here in the right atrium. Depolarization is passed to the AV node with that slight delay, that 1/10 of a second delay, then to the AV bundle, the bundle branches, and out to the Purkinje fibers. After studying this video, you should be able to walk through, step by step, the cardiac conduction system, including explaining the function of each structure. You should also be able to talk about why the resting heart rate is lower than the intrinsic rate of the sinoatrial node. You should be able to discuss why there is a delay between atrial contraction and ventricular contraction, and you should be able to explain the significance, the importance of the AV bundle.